When I was 12 years old, I developed diabetes. We had no way of knowing our blood sugars except if we went to a hospital or a doctor's office. When I was about 15 years old, I developed what's now called gastroparesis. I had severe burning, retrosternal burning that's in my chest. I used to eat about 2 bottles of Rolaids per week. Helped a little, it didn't help a lot. I developed night blindness. I had a lot of trouble with my teeth. I had infections that were hard to heal. Took a lot of antibiotics. When I had a cardiac stress test, it was found that I had cardiomyopathy. I couldn't tolerate people who were in charge making mistakes. So I would yell at my boss. And of course, whoever my boss was at the time didn't like it. And I would get into trouble because of the hypoglycemia. I didn't know my blood sugar was too low. They didn't know it was too low. We had no way of knowing. I was trained as an engineer and worked for about 20 years as an engineer or as a business executive. I spotted in one of their trade journals an advertisement for a meter that was being sold to emergency rooms. So I said to myself, gee, I'm an engineer. If I knew what my blood sugars were, maybe I could do something about it. Maybe I could avoid these hypoglycemic attacks. And that would make life a lot easier for my family. Anyway, I bought this meter. I'll show it to you. Just one second. Here it is. It weighs 3 pounds. So I would carry this meter around with me in a shoulder bag. And I was able to conduct experiments to help me figure out what was going on. The first thing I wanted to know was how much would 1 unit of insulin, remember I had to take insulin to stay alive, I'm a type 1 diabetic, how much would 1 unit of insulin lower my blood sugar? Another question, how much would 1 gram of carbohydrate raise my blood sugar? And with that information, I started measuring blood sugars many times during the day. So I rapidly learned that there was no way to control my blood sugars with the high carbohydrate that I was eating. I neglected to mention that I was one of the first people in the country put on a high carbohydrate diet because of the fear in those days that dietary fats would raise your cholesterol, and that in turn would cause heart disease. And diabetics were dying like flies of congestive heart failure. We now know a lot differently. We now know that the heart disease in diabetics is caused by high blood sugars. We know that the heart disease in non-diabetics is usually caused by inflammation, and that the markers of inflammation are not cholesterol and fat-related substances, but inflammatory markers like C-reactive protein, lipoprotein small a, and so on. Well, with all these measurements, I learned a number of things that were very important. The most important of those was that even small amounts of rapidly acting carbohydrate would send me very high and faster than insulin could lower it. So I couldn't take a shot of insulin before a meal and expect to prevent a blood sugar rise. I couldn't take it a half an hour before a meal or an hour before a meal to prevent a blood sugar rise. The food just worked faster than insulin. So it didn't take a long time to learn that I had to greatly restrict the carbohydrate in my diet. And eventually, I was able to keep my blood sugars essentially normal around the clock, and certainly eliminated the severe hypoglycemia, much to the relief of my family. I tried to convince my doctor that he should be doing this with all his patients. I tried so hard with him because he was president of the American Diabetes Association. And he said, what are you trying to do? You're going to put me out of business. My patients come to see me once a month for a blood sugar. If they did it themselves, I'd have no patients. I wrote up the method I had worked out for keeping blood sugars normal around the clock, which is now called basal bolus insulin dosing. And I tried to get it published. At the same time, doctors were criticizing me, because I was approaching a lot of doctors, that there was no value in normal blood sugars. Doctors kept saying, you're going to drive these people crazy, they'll be severely depressed. And we tested both groups. Both came through as severely depressed before the study. By the end of the study, when they knew how to control their blood sugars, the score was normal. They were no longer depressed. And when you interviewed them to find out why they were no longer depressed, they all gave the same answer. And they frequently used the same words. I'm now captain of my own ship. I'm not getting random blood sugars hitting me out of the blue. I don't know where they're coming from. So that was a big accomplishment. While these studies were being performed, I tried to get the method published. It was rejected by every medical journal I submitted it to, with some pretty stupid statements, like no one in his right mind would let an electrical device tell him how to treat his diabetes. So I finally, in desperation, went to medical school in order to get an MD after my name so I could be published. And I've been practicing medicine since 1983, close to 31 years. I've treated several thousand patients, mostly teaching them how to take care of themselves. And that's what I'm trying to do for you right now.